Welcome back to Newswatch 12. This morning I am joined in the studio with Kristin Filer from Providence Medford Medical Center. Thank you so much for being here.
My pleasure.
Now, Kristin, we've been talking about breast cancer prevention, diagnosis, and treatment all month long in honor of Breast Cancer Awareness Month. But today we're talking about history and specifically family history.
Right. So there's a couple things that your doctor needs to know about your family history. That's very important because it can impact when you're screened, how often you're screened, how early you're screened, and if you need genetic testing. Okay. So as it relates to breast cancer, 5 to 10% of breast cancers are because of a genetic mutation. So not a lot, but if you have the genetic mutation, you are about a 45 to 60% chance that you'll have breast cancer in your lifetime.
Wow.
So it starts with knowing your family history. Now I know when we go to the doctor and I always fill out ad nauseum what my symptoms are, why I'm there, but then I look at it and I say, well, who cares what my nephew has or my cousin has and what their cancers are, but very important as it relates to breast cancer and really other types of screenings. Yes. So look at the 2 to 3 generations around you, people that share your blood, your DNA. So look at grandparents, your parents, their siblings, so your aunts and your uncles, their kids, your first cousins, and then your siblings and their kids, so your nieces and nephews. So look at all is a wide net. So look at all these people that share your DNA. And what the doctor wants to know is, do they have cancer? Have they ever had cancer? Specifically breast cancer, ovarian cancer, prostate cancer, so looking at the men in your family, and even pancreatic cancer. And then the other big thing too is how early were they diagnosed in life and what age did they die of it as well. You really want to know too if they were diagnosed with cancer under the age of 45. Very important. So knowing this stuff can kind of trigger whether or not you need to be screened earlier in life, frequently, how often you're going to be screened, and whether or not you need to have genetic testing done.
And so that leads right into my next question is, if you do have a family history, how early should you be getting screened?
So this is going to depend on who it is in your family that has it, what type of cancer it is, and it's kind of a conversation between you and your doctor about whether or not you're going to need to get genetic tested. If anyone in your family has genetic testing done, it's kind of nice to know were they positive for any gene mutations. But it's going to be a conversation between you and your doctor. A lot of times, I know with colonoscopies even, most people get tested at 50 to have a colonoscopy, but if you have a family history, you can have a colonoscopy as early as 40 years old.
Wow.
So it's kind of a conversation with your doctor on whether or not you need to start having a mammogram now in your 20s or wait until you're in your 30s.
I see. Well, thank you so much for coming in. This was so helpful, and it just shows you need to be prepared and have those specifics lined out before you head to the doctor.
Have a conversation with your family over the holidays
definitely.
about their diagnoses and if they've ever had any cancers.
Yeah, great. Well, thank you so much, Kristin. We really appreciate it.